One of our responsibilities as a hospice is to do all we can to manage their symptoms, because we never want someone's decision for MAID to be just because we haven't managed their symptoms. And I know that's another concern that hospice and palliative care as a whole has brought up over the years with this, right? If we're truly managing someone's symptoms, then would they want to end their life?
This is the Heart of Hospice podcast with Helen Bauer. I'm talking with hospice social worker Lisa Pahl today about what it's like to support someone utilizing medical aid in dying. Whether you're a family caregiver or an end-of-life professional, the Heart of Hospice podcast is here to enhance your hospice experience by connecting you with information you can use about end-of-life care.
Navigating end-of-life care can be confusing and overwhelming. Hospice Navigation Services can help. Hospice navigators are hospice professionals with at least 10 years of hospice experience, trained to provide accurate, unbiased information. Hospice Navigation Services, the guide for your journey.
Lisa Pahl is one of my friends. Lisa is a social worker and an ER crisis interventionist. She's got a master's degree in social work. She's worked in the mental health industry, in the emergency room, and within her true passion, which is hospice care. She's witnessed hundreds of deaths, which she says has taught her so many lessons about truly appreciating life. She is also the co-creator of the Death Deck. And if you've listened to the Heart of Hospice podcast, you know that I've sort of been Death Deck crazy for quite a while now. The Death Deck is a card game that's designed to start lively discussions about dying, end-of-life wishes, and just death in general. So you're going to love this interview with Lisa Pahl. It's got some depth to it, and I'll tell you right now, it is about medical aid in dying, which can be a controversial topic for a lot of people. But my view as a hospice nurse is that if a patient were to ask me here in the state of Texas about medical aid in dying, I need to be informed enough to say, we don't do that here. Here are the states where it is legal. Here's a website where you can go to find out where it can be utilized. I don't have to believe in it. I don't have to support it, but I do need to be aware. So if you are an end-of-life professional, whether or not you support a death with dignity law in your state or medical aid in dying, it's a good idea to be informed. So that's what Lisa Pahl is going to be talking about. She practices out in California. She's going to be talking about her experiences with medical aid in dying and what it's like to be part of that process for a patient and a family. So here's my discussion with social worker Lisa Pahl. So welcome back to the Heart of Hospice podcast. It's great to talk with you today.
Oh, thanks, Helen. It's so great to be here.
It's like having family back. It's like a family reunion. Well, we've got a heavy topic today, so I'm going to start out with just a light question and ask you what you're binge watching or binge reading these days.
Oh, boy. We just finished White Lotus, which is quite an intense tale, but oh, so good. Oh, so good. We also, as a family have continued watching Survivor all these years. And
I didn't even know it was still on. Wow.
It's inspiring. It really is. It's inspiring to me to watch these people really. There's so much emotional growth. The social worker in me loves it because you see people kind of like raw and really revealing themselves, and it's just both entertaining and also like a really interesting study of human behavior. And so I just eat it up.
Interesting. I'll have to check out White Lotus. I haven't watched that one. I'm always looking for something new, my next fix. So we do have a pretty heavy topic today, and you're definitely the expert in this one as far as you and me. We're talking about medical aid in dying today. And Lisa, you practice your social work in the state of California, where there is a death with dignity law on the books. So medical aid in dying is legal. Here in Texas, there isn't one. What can you tell our listeners, just as general overview, about the medical aid or MAID law that California has and how hospice agencies are involved in that?
Sure. So in California, medical aid in dying, the law behind that is called the End of Life Option Act. This went into effect in 2016. So it's been over 6 years now that we've, June of 2016 to be specific. So it's been over 6 years that this has been practiced in the state of California. Originally, the law was written that patients first complete a written request to their physician and a verbal request, wait 15 days, submit another verbal request, and then another written request. So it was very cumbersome and lengthy. What happened was too many people died before they could complete the process. So in 2022, California reduced the time frame from 15 days to 48 hours between the two verbal requests. And they eliminated the need for the second written request. So effective this year, the process has been much less cumbersome for patients and their family members. And quite honestly, we've seen more people be able to take advantage of the medical aid in dying with those changes. It's also written that the patient needs to be a resident of California. They need to have a terminal diagnosis. They need to have capacity to make their own decisions. And they need to voluntarily request it on their own, not be coerced by anyone else. So I was looking up some data before this interview because I was curious. And in California in 2021, 767 individuals completed and sent in their written request to the Department of Public Health. So public health keeps records of this. So only 767. I was very surprised that that number was even under 1,000 people. And then 58% died after taking the medications. So just over half. So a bunch of people didn't take the medications once they got them, which we've seen as well in our hospice. Some people just like having the medications there, knowing that, as one patient said to me, if it gets too bad, I know that I have this relief if I can't tolerate this anymore. And it's a comfort to know that there is that option.
Right.
With regards to hospices have, a choice of course, in how much they participate in the medical aid in dying. So we have, in my community, we have Catholic hospitals and hospices that do not participate at all, meaning they do not have a physician that will write prescriptions, and they don't allow staff to attend the medical aid in dying when they're ingesting the medication. So some hospices take that stance. The hospice that I work for, our medical director will prescribe, and our staff are encouraged to be present. So we are fully involved in our hospice. Staff members can decline. They don't have to be. There's some nurses or other staff that don't feel comfortable with it. And so we have another nurse step in for the family when that happens.
So what are some of the reasons that the hospice staff as individuals may choose not to be involved with a patient's case when they're going to utilize the medical aid in dying? I'm sure they have various different reasons.
Various reasons. The most common one that I hear from my colleagues is their religious beliefs. believing that, only God determines when someone dies. And in addition to religious beliefs, some people just have their own moral and ethics that tell them that they don't want to be involved in hastening anyone's death.
Right.
So, and quite honestly, when this law first came into effect, I had been involved with Compassion and Choices, and I felt very strongly I wanted this law to take effect in California. And so when it happened, I was thrilled. And initially, our hospice was not on board. And initially, I was absolutely in the minority of staff. And it took a couple of years for everyone to get more comfortable. And initially, our medical director wasn't willing to prescribe either. So we didn't have a physician. So it took time for us as a hospice agency to adjust. And now the people who do not participate are in the minority. The tide is shifted. And I think some of that comes from once you attend these deaths, you see all the positives as well. And you see, that this isn't as scary as you may think. I mean, some nurses also are afraid because they haven't done this before. They haven't been present. They don't know how long it's going to take, what will happen if, all these questions. And so what we've been doing is we've been pairing up the nurses. So if a nurse hasn't been present for a MAID death, that the first time they go, they'll have another nurse with them that has been. And so they do a joint visit together to give the nurse experience, because it's a whole different experience than a non-MAID death. And so there is just a level of comfort and needing to reduce the fear of what they should be doing.
I would think that for hospice folks, it's a lot like, nurses and physicians being trained to heal and get people stronger, help them become more independent, help them get well. Well, in hospice, it's not about hastening death. So helping a patient to precipitate a death like that sort of goes against hospice philosophy, the way we've practiced it in states where there is no MAID law. Mm-hmm. It sort of goes against our nature, because we always tell people we don't hasten death. Mm-hmm. So, yeah, I can see that would sort of go against the grain.
And that's a really valid point. I know that some hospices are concerned that if they participate in MAID, or if they're vocal about their participation in MAID, that the community may believe that hospice is indeed killing people.
Right.
And we continue to spend a lot of time and energy convincing people that we don't do that, that we are just supporting people along the way. And then we have this complicated, it's almost an asterisk, except in the cases of MAID, in which we aren't actually killing them, but we are,
right.
And, we are present when they ingest a medication that will end their life. But, the law is clearly written, and I fully believe that this is not suicide. And in my worldview and in how I look at this, this is you cannot qualify for medical aid in dying unless you have a terminal diagnosis.
Right. It's not just random.
It's not just random. And looking at the stats, I think it was about 97% are on hospice services. And the vast majority are cancer patients who choose this. So, and it's people who typically have undergone a lot of treatments, a lot of pain, a lot of, whether they call it suffering or we perceive it as suffering, but, they are struggling. One of our responsibilities as a hospice is to do all we can to manage their symptoms, because we never want someone's decision for MAID to be just because we haven't managed their symptoms. And I know that's another concern that hospice and palliative care as a whole has brought up over the years with this, right? If we're truly managing someone's symptoms, then would they want to end their life? And so that is part of our process of for our medical director to, when they assess the patient, is really diving into if we're managing their symptoms and making sure that we manage their symptoms, to the best optimum that we can prior to signing off on MAID, so that we're not just looking at a person who's just come on to hospice, whose pain is unmanaged, who says they want to die.
Right.
Our medical director and how the law is written is we need to, they need to not be in distress when making these requests.
Well, I mean, it makes sense. And hospice already has this reputation, the urban myth that if you come onto hospice, they're not going to treat you for certain things. They're not going to manage if you have an infection, or they're not going to do any wound care, which of course is not true, because we do both of those things. Like in Texas, people don't always want to sign a DNR because they think they can't be treated for things. Mm-hmm. Or they won't get equal treatment. Oh, well, they want to go ahead and die anyway, so why would we manage the pain, nausea, anxiety, shortness of breath, that sort of thing. So I can see where that would be one of those. It always comes back to education. Mm-hmm. The community at large needs to be educated.
Navigating end-of-life care can be confusing and overwhelming. Hospice Navigation Services can help you navigate hospice care for the best end-of-life experience possible. Hospice navigators are hospice professionals with at least 10 years of hospice experience, trained to provide accurate, unbiased information. Our team's compassion and respect for quality of life allows them to help you focus on getting the kind of care you want. When you need in-depth information about hospice, a Level 1 navigation session can provide information on what hospice care includes, roles of the team members, and how to choose a hospice agency. A Level 2 session is the best choice if you want to include multiple members of your family or caregiving village, and includes an explanation of hospice costs and coverage. If you have specific questions about a current hospice experience, a question and answer session with a hospice navigator can give you the answers you need. Watch for the launch of the Hospice Navigation Services in January 2023. Hospice Navigation Services, the guide for your journey.
So let's get into the weeds a little bit deeper as far as the role of the clinicians, social worker, chaplain, nurses, the role of the clinician in the care of a patient who is elected to use MAID. What's a typical plan of care for the social worker interventions for a patient who is going to utilize MAID? Sure,
yeah. First, I'll say that the nurse's primary role is to continue to manage the symptoms to the best of their ability, or the physician, with the physician assistance. And then the social worker and chaplain are the primary team members who are exploring and processing the feelings surrounding this request. So my role, is to both explore with the patient themselves and the family. Within the written request, there is a checkbox that the person has discussed with their family or other people in their life. It isn't a requirement that they have to, but it is noted if they have. And the vast majority of people all do. And so, as you would imagine, sometimes there are family members that are not on board. And who struggle with the fact that that the patient wants to choose MAID. In those cases, we facilitate those conversations between the patient and the family. We speak one-on-one to the family members. It's not our role to convince them of anything, but rather to facilitate these conversations between the patient and family and try to come to an understanding. In my experience, most of the time, if family members aren't on board, the patient elects not to take the medication. typically.
Oh, really?
Yeah. In my experience, again, because I mean, it takes a lot of courage to go through this process.
Yeah.
And if you don't have your support people on board, it can become quite a conflict, and that really affects the quality of their life. And so sometimes people say, okay, I'm going to let it go. I don't want my family members who are going to live on to have concerns about how this death happened,
Right.
or have regrets or any of those things. So, but most of the time, I would say most of the time family members are on board. Most of the time we come to an understanding, and most of the time they are on board. The other thing that we help with is we explore with the patient what they want that death to look like, basically. So one of the aspects of MAID is that you can orchestrate your death. You can choose the date. Well, these all have an asterisk because sometimes people's illness progresses too quickly and they get too sick and can't take it, or,
Sure.
but in general, you can plan the date. You can decide who you want to be present. If you want music playing, you want the ambiance to be, if you want any rituals completed or any final activities together, what scent you might want, all of these little tiny details that we don't necessarily always think about. When you begin talking about a MAID death, there's planning involved. And so to me, one of the most powerful things about these conversations is that people who choose MAID are open to talking about death and dying. So these conversations, they can just be so rich and poignant and profound, and helping people kind of picture and plan this death, and getting to be there and helping facilitate it all to happen. For me, it's deeply profound and moving.
I would think that a lot of people don't realize we have hospice patients that don't talk about dying with their families. They don't talk about dying with their social worker or the chaplain or even the nurse. They don't want to talk about it. They know it's coming, but it's that elephant in the room, and they're just going to let the elephant slide right in and fill up the room. And for them, the comfort level is to never have those conversations. In my view, my work experience, that's frustrating for hospice people, for hospice professionals, end-of-life workers, doulas, nurses, social workers, and chaplains, because this is what we do. And we're certainly willing to have those conversations, right? We probably more than we should be, but we have a lot of people that don't take us up on those skills. Mm-hmm. So to be able to participate in something like that, because I think that having a conversation about a death that's imminent is quality of life. I think that contributes to quality of life. And it leaves a legacy with that family, what I call a death legacy. What memory do you have of your loved one dying? Mm-hmm. Was it agonizing and you fought and you disagreed, or was everybody on the same page and it progressed sort of the way you wanted it? And in MAID, I would think there are some opportunities to create the kind of death that you want, where a lot of times we don't get that. Mm-hmm. Our patients don't get to have that.
Yeah, I absolutely agree. I am always surprised at how few people want to talk about death and dying while they're dying, and even the family members, that's a huge piece of my job is to help the family members kind of recognize the signs of decline and process that with them. And, a lot of people really want to avoid those conversations, and they, and people who are dying, like you said, they will often avoid those conversations as well. And some of it is this need to manage symptoms, right? And like the burdens of the day and how people are feeling. And, there's a lot of things that go into why people avoid these conversations. And I certainly have empathy for however people are coping, but as a professional, I feel the most useful and helpful when we can have these conversations. And quite honestly, it's very moving to me. It's very, it's just profound. I had this conversation with this gentleman a couple of days before he died, and I asked him, what do you think it's going to be like? And what happens after you die? What do you think? And we had the most rich conversation, and he was contemplating if him and his wife would actually be married in heaven or if he could date. And, there were so many, we laughed and we just talked so openly. And it was I'll never forget that particular conversation with this gentleman. And we, within MAID, because they have to speak openly about death and dying to do these requests, there's more comfort and ability to communicate that way. And so I get to have more of those type of conversations. And, selfishly, it enriches me and fulfills me and helps me continue on to do my work with other families who we're avoiding the conversation.
But let's flip it over, because that's a lot of wear and tear on a social worker or any hospice professional, end-of-life worker. Have you found that your compassion fatigue has increased, or do you have to give yourself more intensive self-care? Are you aware that it's more difficult for you? When you've been working with a patient who chose the MAID law.
I would say overall, for the reasons we just discussed, the meaningful conversations and how profound these experiences are, I think it mostly fills my bucket rather than empties it. However, I will say that it is very, very intense. And so even though this feels like some of my most meaningful work, it is also the most intense work. And I have found myself needing to come up with additional strategies for dealing with the intensity of the work. Sometimes people will survive hours and hours after ingesting the medication. And so when that happens and I'm in the home for hours and hours, it is draining and it is taxing. And so what we've done at our agency is we have a handful of people who are kind of, seen as the experts with medical aid in dying because they've had that much experience with it. And we tend, we've kind of formed our own little support group amongst us where we, process and talk back and forth about and debrief. I will usually be present with a nurse. And so, we're in it together and we can process afterwards. And that helps a lot.
Do you feel like working with patients who are utilizing the MAID process, the procedure, do you feel like it's changed you as a person?
Yes. I think there's a couple tasky things that it's changed about me, or my role. It's made me more comfortable with doing rituals and creating rituals. As a social worker, that's not really part of our training, but I've dabbled into, some trainings with my death doula friends, like Gabby of the Hospice Heart. So I really see the value of these rituals now and love incorporating them with non-MAID patients. And I also am incorporating more of these planning questions with my non-MAID hospice patients and the ones that are willing to talk about it. And so it's impacted my practice in the way that I feel like I have more tools and I'm helping all of my patients better prepare. And then personally, like I've said, each of these MAID deaths have stuck in my head. it's really an honor to be asked to be there when someone is ingesting the medication, and to be asked to be there for their family. Patients have told me how comforting it is to know that I'll be there supporting their son, and I'll be there after supporting their son. It's almost hard to put into words how powerful that is, and what it's such intimate work. This is perhaps the most intimate moment of their life, is their planned death. And so I feel so grateful that I get to have these powerful, meaningful experiences that I carry with me, and I am changed.
That's wonderful. This is why we do what we do. Mm-hmm. If anybody ever wants to know, why do you do this kind of work? That's the answer right there. So, Lisa, you know that one of my favorite things is the Death Deck. You are the co-creator with Lori LoCicero. Where can our listeners get their own Death Deck?
You can get the Death Deck at thedeathdeck.com or Amazon. You can follow us on all of our social media. I like to do a lot of education, and, we post every day on Instagram, trying to normalize conversations about death and dying. And our goal is that if we can get more people talking about death and dying when they get to hospice, when they have a medical crisis, they will be able to talk, and the families will know what their wishes are. And we do also have an end-of-life deck coming out. This is our new deck, all new questions, 52 questions, both open-ended and multiple choice. And this deck is specifically for people with serious illness, people who are on hospice, palliative care, to be used both by professionals and patients and families as well. Yeah, that'll be released in February of 23. And we're so excited to have this additional tool, that's specifically for our hospice and palliative care folks.
Awesome. I can't wait to see it. That's going to be great. Well, Lisa, thanks so much. Loved having you back on the show. Thanks for talking with me today.
Thank you, Helen.
So obviously, working with patients who utilize medical aid in dying, who utilize MAID, it's changed Lisa. It's had quite an impact. She talked about the experience being very intense. And I think hospice providers in general have strong feelings about the intensity of being present for a death event, but participating in a MAID death can be particularly maybe overwhelming or intense, a very concentrated, intense experience. And it does sort of fly in the face of the philosophy of hospice not hastening a patient's death. It sort of goes against what we believe and the hospice philosophy itself. But it's such an important work. Lisa stated that 90% of the people who are using MAID are hospice patients. So it's so important that the hospice community at large, again, whether your agency participates in MAID or not, that we are educated and informed so that we can in turn educate our patients and their families. I thought it was interesting that Lisa's experience showed that when family members aren't accepting of using MAID, the patient will choose not to use it. And really, that shouldn't be any surprise, I guess, because patients are often very much influenced by their family's beliefs and wishes. We don't want mom to stop dialysis because she'll die, so mom doesn't stop dialysis. I think that's pretty common. But MAID has some benefits. It allows patients to create the way they want their death to happen, which is a luxury that most of us don't have. The time, the place we get to die, the environment, the people who get to be there. Because let's face it, death even on hospice, is fairly unpredictable. We don't always have people there that we would like to have, and it's not necessarily the environment or the scenario. I mean, a lot of patients die in the hospital, and that's not where they want to be. So working with patients who choose to utilize MAID, medical aid in dying, it changes who we are as hospice practitioners. It changed Lisa. She said so. And it changed her personally as well. Sometimes I think that in hospice, that's one of the biggest benefits we get from working with people who are dying. Yes, we grow professionally. I have always learned something from every patient, every family I ever came in contact with. It made me better clinicians, whether they were challenging or, a very pleasant patient, whether there were family dynamics or whether the disease management was difficult. I learned something from all of my patients and all of my families. I don't know how anybody could work in hospice and especially work with medical aid in dying patients and not be changed. I think it's changed for the better, changed for the good. If you'd like more information about medical aid in dying, we had another interview with an author, professor at Brandeis University, Anita Hannig. It's episode 114. It was published out on August 1st of 2022. It's a great interview. She wrote a book about medical aid in dying and the status of it here in the United States. So you can check out episode 114. Be sure to catch the next episode of the Heart of Hospice podcast. You can find more episodes on theheartofhospice.com. Don't forget to subscribe on your favorite podcast platform. You can connect with the Heart of Hospice on Facebook and Instagram and send your questions or comments to me by email at helen@theheartofhospice.com. And remember, no matter who you are or where you are in your hospice journey, you are the heart of hospice.